Hi, everybody, and thank you to Bradley and the Voice of Healthcare Summit team for the opportunity to present this session today. My name is Nathan Treloar. I'm President and COO of Orbita, and the session today that we prepared is to discuss lessons learned in omni-channel telehealth. And I'll maybe put a little finer point on that title. Our attention really is on the application of virtual healthcare technology in remote care, remote and telehealth care. So telehealth is a fairly broad topic. We're going to focus specifically on applications of technology like voice assistive technologies and chatbot. And I'll elaborate on what we mean by omni-channel, but very quickly, omni-channel just means being able to reach the patients across the digital devices that they're comfortable and able to use. And you see a couple examples in this image here of an Amazon Alexa powered voice device as well as a smartphone. So before I jump into these lessons learned, I'll give a little background on the company of Orbita. Orbita is a software technology company, and we work across the healthcare industry supporting our clients in adapting technologies for voice and conversational AI to improve patient engagement, to reduce costs, and generally improve outcomes. And we do that through a platform that is designed to simplify the creation and maintenance of applications that use voice and conversational AI. And our claim to fame is we are an enterprise-grade platform with HIPAA compliant security built in from the ground up, really designed to tap into the power and potential of these next generation conversational technologies like voice. We work across the healthcare industry, just a few of our clients and partners that we work with in the provider space, the pharma and life science space, service providers to the industry, as well as payers. So I'll jump right in and talk about some of the lessons that we've learned. And I'm going to emphasize really the lessons we've learned in the last 6 to 8 months since the beginning of this calendar year, 2020, about how virtual assistive technologies and omni-channel telehealth technologies are becoming more mainstream as a result of the reality of the coronavirus pandemic. We are really adjusting to a new world for sure. And this is the first lesson to take away here in how virtual assistive technologies like voice can and are playing a role. Access to healthcare has changed, no doubt about it. The pandemic has changed attitudes towards how consumers of healthcare services are able to find, navigate, and receive care, whether they're responding to the immediate needs of the virus and their concerns about it, or they're just dealing with day-to-day healthcare issues. The new reality we're in is that access to this care is very different. It's not really just about showing up at the clinic. The virtual needs of healthcare have changed dramatically. And you can see this just in the stats. Healthcare organizations are really switching to a view of digital services and digital transformation. And the rate of change, the rate of adoption of digital technology, particularly in the first half of this year, has been stunning. I can say from the perspective of Orbita, we have never seen an adoption rate or rate of adoption for our technology and solutions at the rate that we've seen in the last few months. And it's driven by an obvious need, which is that we need a way to support really the thousands of and even millions of patients who are out there in need of services in a world where attending physical presence is not likely to occur for lots of reasons, not the least of which is simply risk of pandemic or spread of the virus. So these stats from Forrester are quite compelling. We're seeing likely to see in excess of 1 billion COVID-related visits. Those visits being virtual care visits delivered over a smartphone or a tablet, or might be just a telephone. But these stats suggest a whole new way in which healthcare is going to be delivered and puts an emphasis on virtual care, telehealth, et cetera, in a way that it's never seen before. And what's more interesting is is asked the question, is this a temporary thing, or are we likely to see this persist? And these news stories that came out over the last few months have suggest that we're really in a new reality, much like how 9/11 transformed travel and security around travel and has stayed with us for these almost 20 years. We can expect to see a change in the way healthcare is delivered and the virtual solutions as a result of this pandemic for the foreseeable future. Not just, even once a vaccine may come around, we can expect to see the same level of diligence towards how healthcare is delivered. And the implications for the consumers are evident in some of the statistics that we see coming out. One related to how consumers view access to healthcare and their expectation that they cannot rely on the normal delivery modes. They're expecting, and whether it's actually in place or not, they're expecting this strain to compromise their ability to be in receipt of care. It also is introducing a new kind of healthcare concern, which is the mental health that's associated with living in a world of a pandemic. And then finally, their confidence in being able to access virtual care services is a reality we have to face. If half the patients and consumers out there are not comfortable yet in being able to access healthcare through virtual means, we need to have a way of addressing that. So enter the second lesson, which is the rise of virtual healthcare assistants. So this is a view of all the possible angles of virtual healthcare assistants and the touch points that they can present in a healthcare world. We have in past versions of this conference talked specifically about virtual health voice assistants delivered through Amazon Alexa and Google Assistant. But we also would classify these virtual assistants across different modalities like chatbots and web chatbots, delivered even over a conventional phone and SMS. The idea is that you have these virtual assistants that live at the intersection between a patient, their caregiver, their clinicians, and their care team. Not to replace them, but to augment access to services through virtual means, virtual digital means, all the ones you see here. And this is where omnichannel comes in. Omnichannel means that we're not prescriptive about the kind of device that patient has to use or is able to use in order to access virtual assistive services. They can use whatever device is best suited to their needs, best suited to their abilities, etc. So in the world of COVID and post-COVID world, the main requirements and the main value propositions of these virtual agents, virtual assistants, are around three different axes. One is improving access to care, creating a capacity that allows patients to be in receipt of care when they can't necessarily travel to the clinic, where the volume and the ability for clinics to serve the spikes in care is compromised. Virtual health assistants offer a way to increase capacity. It also offers a more streamlined way for delivering care, where a traditional call center might be the way that a patient could get assistance virtually. An automated service, it can be, again, delivered across any kind of channel, offers a more efficient way. One stat suggests it's 1/10 of the cost to provide a virtual agent versus a live agent. And that number, of course, depends on the nature of the service. And then the other one is really just a safety issue. Virtual care, virtual check-ins offer a way for the healthcare workers to be safe in a world where infection control is a priority. So where are we with respect to the adoption of virtual care assistive technologies in a telehealth and remote care world? Well, it is happening. As I said before, interest in these kinds of technologies has certainly increased with the pandemic itself, but we still face some challenges. One is that while the individuals, consumers are aware of and interested in adopting these technologies, we still have some barriers. The level of interest in the use of this is most poignantly highlighted in this one example from the New York Times article back in April, a woman in Michigan using her Alexa device to actually just ask for help. And unfortunately, she passed away. But the fact is that she was able and willing and, in fact, urgently asking for help through her Alexa device to suggest that the consumer awareness and ability is there for using virtual assistants. But we still have some barriers, one of which is just simply that healthcare systems are trying to figure out how best to take advantage of voice assistive technology specifically in and around the realities of privacy and security, for example, operational deployment considerations, et cetera. The good news is that there is some relaxation around those traditional concerns or legacy concerns, but they're still there, and it's slowed the rate of adoption up a bit. Another kind of piece of evidence is really just around concerns about how much information is being put out there. This is Amazon's response back in the spring when COVID Alexa skills were being deployed to the Alexa skill store. Amazon put a halt on the kinds of skills and put stricter gates in place to the types of Alexa skills that were being posted and published related to COVID. For obvious reasons, just to make sure that there wasn't misinformation or nefarious skills being deployed. One exception was an Alexa skill was put up by the Mayo Clinic, one of our partners, one of the few that was actually posted and made available to end users for asking questions about symptoms and various information about Alexa, or excuse me, about COVID-related issues, but also simply providing symptom screeners and other types of services through an Alexa experience. The fourth lesson to take away and final one with respect to adoption of virtual assistive technologies in virtual care is what we've learned is that it may seem obvious, but the focus on use cases and integration. So particularly in light of the COVID pandemic, we're seeing a number of different use cases emerge that have general applicability, but have really come to light in this age of the pandemic. One of which is how do you ensure that employees returning to work, whether it's in a healthcare context or other type of context, are remaining safe. And you can see there's quite a lot of interest in this particular topic. And the way we approach it is recognizing that if this is a challenge, and we need to figure out how we can apply technologies like virtual healthcare assistive technology to make it easier for people to go back to work and for companies to support their employees in a safe return to work. So one way we've done this, and one use case to highlight the importance of use cases generally, is an employee screener. And many of you may have encountered something similar to this, whether it's screening you for returning to work or screening to actually go to a clinic. The same use case applies. These virtual assistants can serve as a proxy for asking those questions. Do you feel sick? What's your temperature? Have you been around someone who has exhibited these symptoms of COVID? And these can be delivered on a regular basis. It can be a one-time screening service, but it's delivered fundamentally through a virtual assistant. And here's an example of how these virtual screeners can operate. First of all, one thing that is new in terms of the completeness of these solutions around a virtual assistant is that notification and access to that patient is an important component. So with our partners and our clients, we've incorporated email and SMS notifications that can reach out to an individual, allow them to tap into the virtual screener. And then in the middle, you'll see an example of a bot-based screener, which in the instance of having a voice interface as well, we can take advantage of additional screening capabilities. One more recent adoption is a voice biomarker technology, which uses the the patient's voice and analyzes it using AI technology to determine with some probability whether they're exhibiting shortness of breath and things like that. And then finally, to complete the solution, a dashboard that allows the information that's being gathered around each employee to be accessible by a care coordinator, where the care coordinator can work with the employee if they're exhibiting any symptoms or not, and ensure a safe return to work. So this is a fully integrated solution where highlighting that fourth lesson, that integrated solutions around these virtual assistive technologies is key to really driving value. So to recap the 4 lessons, one is, particularly in light of COVID, we're really adjusting to a new world, one where, in the second point, virtual assistants have become more relevant and more relevant than they've ever been. Omni-channel, meaning simply that they can be accessed through any digital endpoint. But also highlighting that a third lesson, while adoption is happening, it's happening with some understandable conservative perspectives on it. Less conservative than, say, a year ago, but it's still happening slowly. And finally, focus on the use cases and integration with other services. This is a key point in delivering value around these solutions. So with that, I will thank again Bradley and the team, and also thank everybody working on the front lines, those of you who are listening to this and have been on the front lines. So we thank you for all your work. Thank you, everybody.